Good afternoon. Well, we are trying to explain a little short this issue. Well, as you know, early this morning and also tomorrow, LA testing includes, at the present time, the performance of routine coagulation tests, as indicated here, plus a specific LA-specific test. The ISD8 guideline recommends performing two different types of tests or clotting tests, DRBBT and APTT-based clotting assays, and using the three-step procedure, mixing, screen, mixing, and confirmation, and using for paired APTT and paired DRBBT, this is a list of different assays you can see as a screening, as a confirmation, LA-sensitive tests and LA-insensitive tests. The different antithrombotic drugs affect or interfere with almost all assays, clotting assays. And for example, for those assays used in LA testing, you can see that, for example, as a summary, that classical heparin prolongs APTT mainly, well, APTT and thrombin time in a dose-dependent manner. Low molecular weight heparin slightly prolongs APTT and TG, or thrombin time, but silica clotting time and DRBBT is only prolonged if heparin or concentration exceeds heparin neutralizers. In the case of vitamin K antagonists, all assays are affected depending on the level of INR. And for the last antithrombotic drugs, the direct oral anticoagulants, all of them, in different ways, modify or interfere with all clotting tests, depending on their antithrombin or anti-TNA drugs or inhibitors. In this case, the thrombin time, for example, is only affected or prolonged in the case of the patient is treated with dabigatran or the only antithrombin inhibitor. Here you can see the effect of direct oral anticoagulants on the various coagulation tests. In these figures, you can see, for example, for dabigatran, apixaban, and rivaroxaban, how prolonged and altered DRBBT, APTT, and PG in a concentration-dependent manner. And in the table shown below, you can see the percentage of the prevalence of abnormal results in patients treated with dabigatran or rivaroxaban. Almost 100% of different screening and confirmatory tests are affected by this drug. This new test, the Taipan snake venom time as a screening and the heparin time as a confirmatory test, has been recently validated and evaluated in an international multicenter study. This was explained in detail early this morning in a session. The results of this test are expressed as a ratio, Taipan heparin, and you can see here only as a summary how these new assays showing a good correlation with the classical LA test, DRBBT and APTT. This assay shows a sensitivity of 78% and 95% specificity, and the validation of this study, or the conclusion is this is useful and have been validated for using in non-anticoagulated patients, in patients treated with vitamin K antagonists or under anti-TNA inhibitor or DOACs. And it's not useful, it cannot be used in patients treated with antithrombin direct oral anticoagulants or under heparins. This is only a title of the last recommendation of the ISD8 guidelines, the 2020, where whenever possible, blood for LA detection should be collected in patients not receiving any anticoagulant treatment. Perform testing when patients are not on anticoagulant therapy at least 48 hours after ceasing DOACs or 1 week after ceasing vitamin K antagonist. In patients treated with heparins, the recommendations are that heparins interfere with LA clotting assays. However, although classical heparin and enoxaparin affect the DRBVT at supratherapeutic anti-10A levels, they may not lead to false positive LA in a 3-step procedure as recommended. Some reagents contain heparin neutralizer, but it's important to verify the levels of heparins that are quenched in these reagents. Samples should be taken, when feasible, at least 12 hours after the last dose of low molecular weight was administered or as near as possible to the next dose. So in this case, thrombin and anti-factor 10A activity will help to identify LA if possible. And in any case, in any of both assays, thrombin is prolonged or anti-10A is positive, LA testing must be stopped. If the patient is on vitamin K antagonist, consider performance of LA as a mixing study. Note, however, that although this was identified as a recommendation in the 2009 IST8 guideline, it is not a recommendation in the last guidelines because of the potential to miss weak LA. Although in vitamin K antagonist treated patients with an INR less than 3, LA testing is discouraged. If attentive, results should be interpreted with care. Type I heparin tests show good sensitivity to LA in patients anticoagulated with vitamin K antagonists. You all have to know that this test in isolation cannot detect every LA, so a negative result does not exclude the presence of a LA, but a positive result is diagnostic for LA. In this case, with patients, it's important that DRBVT and APTT classical LA tests must be interpreted with care, and it's very useful mixing study and also the type I heparin test. When patients are under direct oral anticoagulants, it's feasible LA testing should be progressed after a brief introduction of DOACs on a pragmatic empirical basis at least 48 hours after the last dose, and longer in patients with renal impairment. If required to test while on anticoagulant therapy, test anadir levels, test samples taken before next dose of DOAC. However, be aware that even at trough DOAC levels, a lack of DOAC effect on LA tested cannot be guaranteed, even if a DOAC neutralizer is used. When using a direct oral anticoagulant neutralizer, testing the DOAC level before and after the neutralizer will provide some evidence of DOAC-free LA testing. In the case a patient is treated with antithrombin inhibitor, the thrombin time is very useful. If thrombin time is prolonged, the LA testing must be not evaluated. In the case of patients treated with anti-10A inhibitors, if this is positive before the analysis, only the type I heparin test can be used. There are several studies in the last years reporting about the DOAC removal or neutralization in vitro with using different devices or strategies, DOAC stop, DOAC remove, and DOAC filter. But in general, all of them reduce DOAC interferences in LA tests, but as incomplete direct oral anticoagulant removal may occur, DOAC measurements should be performed after removal, filtration, or neutralization. So, in conclusion, all anticoagulant, all antithrombotic drugs affect the safe use to investigate LA, but to a variable extent. If possible, investigation of LA will occur at a time when patients are not on an anticoagulant, However, should this be unavoidable, there are several strategies available to mitigate anticoagulant interferences, including the use of various anticoagulant neutralizers. Thank you very much.